Very, very good morning, dear friends. Today, our topic is the diagnosis to gynecological disorders or Prasudi and Stri Roga. Okay. Not only gynecological disorders, considering in Ayurveda, every concept, this is the base. Okay. So here, I'm expressing my sincere thanks to all of you, and also especially our respected Krishna Kumarji sir and this institution for inviting me most of programs of here. So coming to our topic, especially here we can consider that from this picture it's clear. Okay. A system like lock and key. If we consider a diseased person or Rogavastha into a lock, and to open to that lock, we have to specific diagnosis and selection of drugs. Or we have nourishes with so many medicines, Ayurveda preparations, formulations, etc. But opening that lock, we have to enter that patient, the heart of that patient, through a specific key, which having special diagnosis or proper diagnosis, proper selection of medicine, proper understanding of the disease. Then only we have to reach in a success pathway. Then only we can enter into that heart of the disease or heart of that patient. Am I correct? Yeah, okay. So, how we can enter? Three important one. Darshana, Sparshana, and Prashna. In every aspect, it's very true. But especially in gynecological conditions, without this Darshana, Sparshana, and Prashna, we can't reach a proper diagnosis. Okay. For that, in our clinics, in our day-to-day practice, most of the patients are coming with our OP with so many reports and records. Okay. So we had to know the proper understanding of the modern investigations, modern rules, etc. And also our concept of the application of our basic concept to that area. For that, the examination and differential diagnosis is also important thing. For that, just I am passing through a history of a case. Once a patient is presented, it's a 21 years reproductive age group patient, presented with Pradhara. Pradhara we know, excessive bleeding. The patient was regular, painful coitus. There is no missed period. The patient saying that there is no missed period, but even though we are going into deep and deep, there is 1 or 2 days of missed period, but not mandatory to consider that. Started our first thing, what we are first thinking or first doing, applying how to stop that heavy bleeding. Okay, it's our first thought. Just I started the Stambhana medicines. Even though after 3 days, the bleeding, excess bleeding persists. The patient came. After 3 days, patient again came. She is having a pricking pain on her lower abdomen. Then just I examined and sent for a ultrasound scan. It was a ectopic pregnancy. So, for silly reasons, we are missing such diagnostics. Here, a simple one is there. One, UPT, urine pregnancy test we have to done. Even though in young reproductive age group, if there is no missed period, if there is excessive bleeding, the presentation of excessive bleeding, there may be a chance for ectopic pregnancy. So in our practice, we have to consider such points. So the one tube, otherwise their half of their reproductive health will be lost. Okay. So the differential diagnosis is very, very mandatory. Then one patient presented with chronic LBA, Kadigraha. The presentation of the patient was typical Kadigraha. Then 68-year-old lady. We are also started some internal medicines, Vada and Lomana medicines, and local application for Abhyanga, like some oils, etc. But the patient is not responded well. After 1 or 2 weeks, she again came and said that no relief with your internal medicines or external application, etc. like that. Just after, I think that how to, just needed to examine that patient. After doing the inspection and PV examination, it was a case of maybe chance procedentia. It's complete, the complete uterus is out of that. So that the reason for that kadigraha may be due to this Mahayoni. So is there any role for this external application or thyla? Is there? No. So the differential diagnosis is very, very, very important. Then an adolescent age girl, about I think 17 years old, she's coming at night with severe pain on her vaginal region. And she told that there was a bulging. There was a bulging on vagina. Her menstrual blood became blocked. It's not coming out. Severe pain, unable to touch, unable to sit, unable to walk. And she has having, after 2 days, she has exam. So how to attend my exam? So without examination, how we can diagnose this case? Especially in gynecological, we are very reluctant to do. Am I correct? But it's necessary. What may be that case? You just imagine. It may be? Yeah, yes. Bartholin's cyst, even though that severe painful. So that may be Bartholin's abscess. That must change it into abscess. Cyst normally, there's no painful, but abscess, it's severe painful. Okay. So it's like a Bartholin's abscess. Then we have so many, after diagnosis the case, we have so many medicinal choice. Okay. Like Vidriti Chigilsa, like Traintyaddi Kashaya, then next Avakaha Sweda. So many medicines with us. But the diagnosis is about important. Am I correct? So without the proper Sparshana, Darshana and Prashna, we can't reach to the diagnosis of a gynecological case. Okay. So then coming to the, then also another one, breast examination. Stana Pariksha. Okay. It's very important because some patients are really exaggerating their symptoms. Someone hidden their symptoms. Okay. So here, without proper examination, we can't reach a correct diagnosis. We can know how to examine like that. Not I'm detailing into that case. Okay. So what may be our criteria for analyzing a disease condition? One important one, dosha. Next, dhadus, acne, srodhas, and relating similar vyadis. Okay. Follow. Then coming to the gynecological conditions or prasudi or stri yoga, the common clinical presentations of the clinical presentations are 3 types according to the menstrual pattern, which may be krichrartava, say painful menstruation, then amitartava, heavy bleeding, then nashtartava. From these irregularities, we can reach so many conditions. So coming to the first one, krichrartava. Which are the conditions? If the patient is presenting with krichrartava, what may be the conditions like vada pradoshaja yonirogas, including vadigi, udavarta, etc. Okay. So, but the patient presentation, and we know the modern investigations, etc. for that. So, these different presentations can be grouped into 4 categories. Typical Vataja, Vada Kapaja, Vada Pittaja, and Vada Pradhana Sannibadika. This is the first main heading, Krishrartava. Here it is Vadaja, Vada Kapaja, Vada Pittaja, and Vada Pradhana Sannibadika. Then coming to first category, Krishrartava, presentation of Krishrartava with typical Vadika presentation. Here, when a patient, especially in adolescent age group, patient coming with a spasmodic type of dysmenorrhea. Okay. There is without any pathology. There will be a contraction pain confined to where? Lower abdomen. Colicky and spasmodic nature. Then one important feature is that start few hours before or just onset of menstruation. Okay, the typical Vadaja presentation is having, typically we are seeing the adolescent age group patients with primary or spasmodic dysmenorrhea. Okay, then coming to Vada Kapaja. Here, pain confined to back and front of the region. Then the nature of pain, in Vadaja, this pricking pain, contraction pain. Then Vada Kabaja, here pain will be dull in nature and diffuse. Then in Vadaja, the pain will be with onset of menstruation. Okay. Here Vada Kabaja, the pain starting 3 to 5 days prior to menstruation. Okay. Then what may be the internal pathology in such conditions? In first thing I told, there will be spasmodic without any pathology. Here Vada Kabaja, like if conditions like or pathologies like uterine fibroids, polyp and ovarian cyst, etc. Correct. Then next, Vada Pittaja. The presentation will be dysmenorrhea or Krishnarthava itself. It's a painful menstruation. Then here also pain confined to back and in front. Along with that, some burning sensation or signs of inflammation will be there. Here, 1 or 2 weeks prior to menstruation. In some patients, we can see that in most of the days are painful. Okay, like endometritis and pelvic inflammatory disease. In such condition, the pain associated with periods or Krishnarthava, the presentation of Krishnarthava will be Vada Pittaja. Okay, then next, Vada Pradhana Sannipadiga. Here we can consider this progressively increasing congestive dysmenorrhea. In such patients, while the periods are coming or menstruation coming, they are going to hospitalized, and painkillers, etc. Have to be fed up with the periods itself. In such conditions, the pathology may be like this adenomyosis, endometriosis, etc. The typical feature of endometriosis also, here the progressively increasing congestive dysmenorrhea. So these are the roughly we can classify it into these Krishnarthava 4 varieties. So the treatment principle should be to these doshas also. Okay. Then similar vyadis, in our classics there are so many yonirogas, etc. we studied. Out of that, Vatiki yoniroga. Okay, we have studied. Here also, the lakshanas being Arthavaruk, Alparthava, Vankshana, Parshya, Vedha, and the main dosha involved is about Vada. Nidana also explained here is the Vada Pragobha Karanas are the reasons for that. Then Udavarta. Okay, Udavarta is also Raja Krichrada and dosha predominant Vada. Here the important Nidana considered as which? Vegadharana. Okay, yeah. So, considering this Vishesha Nidana, so important Samanya Nidana, Vata Pragobha Karanas, Ahara Vihara of Vata Pragobha Karanas, they are the Samanya Nidana of every Yoniroga or Krishnarthava, etc. But considering the Vishesha Nidana, here also Vega Udavartanat, Vatalahara, heavy exercise during bleeding days, then coitus during bleeding days, coitus in abnormal postures, stress, abhigada, etc. are the reasons for or Vishesha Nidana for this pathology or Krishnarthava. Okay. Then treatment line should be how to focus. First of all, Nidana, Nidvana Parivarjana. So, everything, especially Vegadharana, we have to educate the people in front of us in clinics, especially students, teachers or working women or everyone. Now we have to educate the people about the importance of Vegadharana. Okay. Here we are in our clinics or in our studies. At Charaka Samhita, we written the 13 Vegas and we passed the exam. But in practice, we forget everything. Am I correct? Okay. But every point, we have to educate the students, teachers, working women, everyone. Even housewife. They have enough time maybe, but not ready to go toilet properly. Okay. So, the importance of, especially in considering this Krishnarthava, presentation of the patient with Krishnarthava, we have to compulsory we have to educate the importance of Vegadharana. Then avoid spicy, dried food habits we know. Without, we are prescribing some medicines and some Saptasara Kashaya or Hinguja, Dijorna, Dhanandara Guliga, Abhayarishta, etc. So many drug of choice with us. And we are sending them back without saying their pathya, ahara, vihara. Not only ahara, we are considering pathyas are like spicy food, chicken, that's only. Spicy, pickles, okay. So our role is over. But more than that, vihara is also very, very important, okay. So then only we can get a good result of that. Then the treatment approach while coming, Vadaja or Vada Kabaja, the spasmodic dysmenorrhea with Vadaja only, some Anulomana drugs like Saptasara. So many choices are with us. Some examples are quoted here. Saptasara Kashaya, Sukumara Kashaya with Mishraga Snekha, then Ashoka, Draksha preparations, like Erenda preparations, because Anulomana is very, very important. If there is Vegadharana, if there is Vadalahara, Vada Koba, then surely, or especially Abanavayu is to be elevated here. So, Anulomana is compulsory to have. Then, while considering the typical, here, the Vada Kabaja, considering this Vada Kabaja pathology, here the fibromyoma is about, or fibroids, uterine fibroids are important one. So, just going to deep into that topic, what are the pathophysiology of fibromyoma? What may be the reasons for that? We know Kaba Vardaka Ahara Vihara, Kaba Vriddhi, Rasadhadu Dushti, and that will lead to Artava Dushti, and Artava Vaha Srodho Dushti. Here, we know, just brush up the modern terminologies also, because the patients will coming with us scan reports, USG reports. So we have to also convince them, okay, we have to draw pictures and we have to find out, then only the patient will convince, okay. Then we have to apply our science, our doshas, our treatment into that aspect. Here, it's a benign solid tumor with smooth muscle. We know common matters about that. Position of uterine fibroids we know. Here, the external pedunculated subserous fibroid, within that wall, intramural fibroids, and inside submucous fibroid. For what we are understanding this? If there is a subserous fibroid, it's outside. Okay, we can say that there is pressure symptoms maybe. If a small submucous fibroid inside the uterus, then we can neglect, because there may be chance for heavy bleeding, severe pain during periods, etc. And it may be a reason for infertility. How it causes infertility? If there is a submucous fibroid, there is the endometrium, the contour of endometrium become lost. So there may be chance for implantation failure. Okay. So we have to consider the small even though there is a small intramural fibroid, mostly nothing to worry. But if there is a submucous fibroid within the uterus which disrupting the endometrium, it may chance to recurrent abortions or like this. Then most of the symptoms are asymptomatic. We know that while taking the scan after pregnancy, then only in some cases we understood the presence of fibroids. So most of them are asymptomatic. Then if the symptomatic fibroids, most symptoms are menorrhagia is one, or heavy bleeding. Then amidartava like presentation. Then krichrartava, we explained later, earlier, infertility, chance for abortion, preterm labor. If the fibroid and baby growing same, then there may be chance for preterm labor. Then IUGR, growth retardation may be there. Along with fibroid, the baby have chance for growth retardation. Okay. So these are the understanding of a scanning report. Okay, if one patient is coming with our USG report, then we have to apply our principles to that. How we can apply? So we can consider this fibromyoma into 3 varieties. This also Kevala Kabaja, Pitta Samsargaja, or Vada Samsargaja. Then how we can differentiate this? If a patient presented with menorrhagia and metrorrhagia or heavy bleeding, that will be pitta samsargaja. Okay. I told earlier that most of the uterine fibroids are asymptomatic. Such fibroids are Kaba doshaja vikaras. Okay. Then some patients are presented with, now the main topic we are discussing, Krishtrartava. Here under the Krishtrartava heading, here is about Vada Kapaja doshas. Out of this we are describing uterine fibroids. Here the presentation will be congestive dysmenorrhea. So painful congestive dysmenorrhea. There may be Vada Samsargaja. Okay. Then here also there are treatment, medicine or formulations are so many we have. Out of these, just discussing some examples here. Kevala Kabaja, if there is Kevala Kabaja, we can apply so many medicines like Lekhana properties, medicines with Lekhana properties like Varanadi Kashaya, Kanchanara Gugulu, Navaisa Churna, Chitragasava, Lohasava, Shaddarana Churna, etc. Some a group of medicines with Kabaja and Lekhana properties. Then, if the presentation of the patient is about Pitta Samsargaja, here the presentation will be heavy bleeding. The patient presentation will be heavy bleeding. In such conditions, we can use which medicine? Dusparshagadi Kashaya, Traindyadi. Traindyadi is having typical Kaba Pitta Shamana quality of medicine. Then Tiktagagrada, Pravala Bhasma, etc. we can use. Then Vadanubandha. If there is Vadanubandha, then Chiruvilvadi, Saptasara Kashaya, Nimbamridasava, Sahajaradi Sevya. We consider this uterine fibroids not typically Kabaja. While a patient is coming, we are written this Varanadi Kashaya, Kanchanara Gugulu for 6 months, for continuous one year. Not only that conception. We have to consider it's a degenerative change also, or Vata predominance also there. So we have to apply some sort of Sneha preparations in such conditions, like Sahajaradi Sevya, Dhanantara Taila, etc. internally we have to give. Okay. So this is our concept about fibromyoma. Then, so we discussed about Vada Kabaja group. Then next into Vada Pittaja. Here the symptoms are inflammatory, signs of inflammations will be there. So conditions like Paripluda, PID, endometritis will coming with congestive dysmenorrhea or Krishtrartava. Okay. Then next to Vada Pradhana Sanibadika, I explained earlier, like conditions like endometriosis and adenomyosis, etc. Here, endometriosis is a very difficult to manage sometimes because the patient presentations will be 3 cardinal presentations we know. Which are they? Progressively increasing congestive dysmenorrhea is about first. Typical Krishtrartava features. Second, dysuria, pain during urination. Then dyspareunia, pain during coitus. Here, all typical features become Vata Pradhana Sanibadika Lakshanas. Then, in some cases, the pain not only to the abdomen or any other parts. One experienced with a case that lung endometriosis. It's a rare case I found. That patient presented during the period time, all of the endometriosis patients will presented with severe pain on abdomen, low back pain, pain to lower limbs, etc. will be there. But this presentation have dizziness. She can't take her breath properly because the endometrial tissues were implanted on lungs. So she can't breathe properly during the periods. Heaviness on the lungs that during. So just a treatment approach I given to that patient like anulomana treatment, like Nayopaya Kashaya, Dhanantara Guniga, then Gandhavaranta with Kalyanakshara for a symptomatic relief, Agastya Rasayana and application of Karpuraditala mixed with Saindhava on chest also. Just after 2 follow-up, we can found that just most of the symptoms are relieved, but even though it's very difficult to manage in such conditions. because lung endometriosis is a rare case in our clinic, and also it's to an extent we can manage that patient and to improve her well-being. That's only, or symptomatic relief we can obtain. Then adenomyosis. This is also typical Vata Pradhana Sanibadhika Lakshanas here. Here also the treatment approach should be, along with Vadanulomana, some Shobhara treatment also given to in such conditions. Like Ardhavilakashaya, Punarnavadi, Traindyadi, etc. we can give. So these are the first topic this past, Krichtartava, that I explained earlier, Vadaja, Vadakabaja, Vada Paitika, and Vada Pradhana Sanibadhika. Okay. Then coming to the next topic, Nashtartava. By hearing the Nashtartava from the term itself, where Artava is lost. Then Artavakshaya is there. Here, Artava is decreased in quantity. Then this Anartava or Alpartava, there are so many different names or different rogas explained in our classical references, like Arajaska, Nashtartava, Lohidakshaya, Artavakshaya, Kshinartava, Vadika Artavadushti, etc. In all these category, this Artava decreased or Artava absent. Okay. Then out of these so many categories, we can group it into two. So for the treatment approach, for treatment easier to diagnose this, we can group it into two, Sandarpanota Vyadis and Abadarpanota Vyadis. Like Dadukshaya, some group will be Dadukshaya, Lohidakshaya, there will be anemia, anorexia nervosa, etc. is the one category. Then next is about Sandarpanota like Avarana, PCOS, Nashtartava, etc. is the other category. So while grouping into these two, we can approach, the treatment approach will be more easy. So here, just I am explaining some more conditions which having Anartava or Alpartava. First one, if the patient is presented with anemia, malnutrition, then anorexia nervosa, etc. Here, the patient presentation will be Lohidakshaya. Here the bleeding will be reduced. What may be Nidana in such cases? Dadukshaya. Okay. Then, in some more patients, most commonly we are seeing in our clinics is that is it visible now? Okay. So the patient presentation like anemia, malnutrition, anorexia with Lohidakshaya, there is no or decreased bleeding. Maybe the reason Dadukshaya. Then in our clinics mostly we are dealing not such type of Nashtartava. This is the common category. Am I correct? Here the patient presentation will be PCOS, hypothyroidism, pituitary tumors, Kabaprameha, Medovriddhi, obesity, molar pregnancy, this category. This is the presentations or diseases. What may be this condition? Nashtartava, Pushpagni, Raktagulma. Here, what's the Nidana? Avarana. Okay. Then, Hyperthyroidism. Patient may be coming with reports of hyperthyroidism. Here also, sometimes excessive bleeding, after that, Lohidakshaya. The first presentation, if the patient coming with hyperthyroidism, firstly, she's have heavy bleeding. After some days, that will coming into low and low, then into Lohidakshaya. Here, the Nidana, Pitta Vriddhi. Okay. Then some conditions like Asherman syndrome, Sheehan's, etc. Here also, Lohidakshaya. The Nidana happens is that, first of all, increased or heavy bleeding, just after postpartum, like postpartum bleeding. So heavy bleeding is there. Then after coming into less and less, like Lohidakshaya. Okay. Then uterine hypoplasia. If the patients are presented with what? There is the hypoplasia of uterus, or uterine size is decreased, endometrial thickness is very low. In such condition, there is no bleeding. Here, Arajaska or Anarthava will be there. The reason, Garbhashaya Dushti. Then narrow cervical canal or imperforate hymen. Here the conditions like Suji Mugi. Okay, here what happens? Marga Rodha. Then next, same, Manodosha, this anorexia nervosa is also coming with some psychological starving. Okay, here we announcing that psychological starving is the reason for reducing the body weight very, very fastly. Then, next is okay. Turner syndrome, chronic anovulation, low AMH, anti-Mullerian hormone, there is Mullerian defect, etc. Which may be that condition? Shanda. Because without the, even we are taking the treatment for infertility or treatment, etc., there may be no chance to success. Because already are categorized into Vantya or Bija Dosha. Okay. Yes. Then premature ovarian failure. Here, in our clinical practice, this premature ovarian failure is very, very, very common now. 3 or 4 years back, the patients are presented with 39 years with POF. But now, nowadays, in today's OPs, the patients are presenting with 24, 25 years. It's very surprisingly saying that. Here, that, how to analyze this POF, this premature ovarian failure, how to be diagnosing? Their FSH value increasing and increasing. Then size of ovary get decreasing and decreasing. There may be no specific reason. Okay. While the patients are coming to as amenorrhea or secondary amenorrhea is there in some patients. Most of them are secondary amenorrhea, not primary amenorrhea, secondary amenorrhea is there. So most of the time we are observing, sir, 40 years or 41 years premature ovarian failure, but nowadays it's about 29 years, even 23 years I found one case. So not to complete authority of that, you have to examine that patient, you have to analyze, and you have to convince them your FSH is increasing and your follicles are not developing properly. It's called Deivadaha. So these are also one group of our classifications. Then this Nashtartava, Anartava or Alpartava. So many different classifications are there. We can group this into 3 varieties. This Artavanasha or Nashtartava due to Avarana by Vada Kabaja. Then Anartava due to Bija Dushti. Okay. Then Artavakshaya due to Vada Pitta. It's clear? Okay. Here, what's happening here? Rasadhadu is not properly converted into, in our language, we can convince that if we are taking the Rasadhadu, it's the proper transmission to Rasa, Rekta, Mamsa, Meda, etc. Here, this Rasadhadu is not properly converted into, next transmission is blocked. So, these 3 classification, we can consider first one, Vada, Kaba, Avarana. This is the major Nashtartava classifications or clinical presentations we got in our day-to-day practice. This type variety is very common. Like PCOS, hypothyroidism, pituitary tumors, like explained earlier. Then Vata Pittaja. Here, oligo-ovulation. There may be ovulation, but it's not properly coming. Then reduced follicle size. Follicles may be coming, but not healthy. Okay. Then premature destruction of follicle. Some follicles have to be ruptured before coming to ovulation on 8th day or 9th day itself ruptured and not get into fruitful conception. Then POF, primary ovarian failure. Dhadukshaya, explained earlier, like anemia, malnutrition, anorexia, etc. So, how to reach a treatment principle for this? We explained what's the nidana, how to diagnosis. Okay. Then coming to the treatment principle, first one, Dhadukshaya. How? What we can do? Simple. Rakta Prasadagara and Pushtigara treatment. Okay. Some lady patients or girls will come in with low HP. Pandu, typical presentations like Pandu. Agnimandiya will be there. Okay. Very tiredness. So, first we have to correct. The basic treatment principle is there, Agni Vardhaga. So, if you are just prescribing the Mandura Vadaga or Navaisa Annabedi, that's not the first line. You just improve their Agni. Simple Vaishwanara Jurna or Ashtajurna enough to improve her Pushti. Okay. After that, we have to give this Annabedi Sindura or Mandura Vadaga. Otherwise, the patient will not respond. Next, Avarana. What's the treatment for Avarana? Important? Samshodhana. Then, Agneya Dravya, Medohara and Vadanulomana. Next, Pittavriddhi. So, here also, Pitta Shamana and Samshodhana treatment. Adipravrti, Nidana. Here also, Dhadu Pushtigara. Then, Garbhashya Dushti. Some cases are explained later, earlier that Garbhashya Dushti will be there. Here, Sthanika Chikitsa and Sthanika Dhatu Pushtigara, like Samutravasti procedures and important. After nourishing the patient, we can do such procedures. Then Margaroda. If there is Margaroda, what we can do? Not only internal medicines are enough for that. And such conditions, Samshodhana and Shastra Karma, like intrauterine procedures described in our classics, we can use in such conditions. Then Manodosha. How to improve Manodosha treatment or psychological aspect? Didhairya Atmadi Vijnanam. Most of the Anarthava or Nashtarthava patients are to be presented with stress. Are you observed that? Even it's Avarana, there also needed some sort of Manodosha Chikitsa. Because that also alter the hormonal imbalances. So, it's very mandatory in every type of cases. It's important thing. Then Anila Dushti. What may be our treatment? Vata Hara treatment and Vata Anulomana treatment. Next, Bija Dosha. What's the treatment we can give to Bija Dosha? Most of the cases, it's asadhya. Okay. I experienced one case. She presented with after married. There is no case of primary amenorrhea is there. But she got married and come with husband. And they presented that she is having amenorrhea. But I know that after knowing, I married her. Her situation I know. But what we can do? Is there anything can done? Just I examined that patient. I found that it's a blunt vagina. Blunt vagina means after inserting that PV into this vaginal cavity, that was closed. Not entering into cervix, no uterus. Other all secondary sexual characters, say beautiful girl with all secondary sexual characters. Everything okay. This axillary hair, pubic hair, breast development, everything okay. But she presented with a blunt vagina. That means no uterus is there. Just after examination of that case, how to reveal in front of that husband? Just I told, this is the factor. You can decide. Because without treatment, with treatment, we can't reach much result. Much result, not much results without, no result. Because we have to say openly to them, convince them. Because such conditions are there, asadhya, or even though we can try in some cases, not in this case or blunt vagina, we can nothing to try. But in POF, if there is the follicles are not developing, then if there was primary periods will be the nowadays it's lost, then we can try with some arthavajanaka medicines and out treatment methods. Okay, in some cases that will get result. Then Devadaha like factors, most of them are asadhya. Then this is the common approach. Then coming to typical Vada Kabha Avarana line, some medicinal choices are written. So many choices are there like Tilakwada, Kulatadi, Kumarya Savaraj Pravartini. Then so many medicines are there. Just I'm putting some examples. Like Varanadi, Kanashadahwadi. Kanashadahwadi is having increasing the Pitta Vardaka property. So that will also Arthavajanaka. Lashuna Yarandadi, Kshara, Palasha Kshara, Kalyana Kshara, etc. Some medicines are there. Then Vada Kabha is over. Next, Vada Pitta. Here this Vada Pitta conditions, what is the clinical presentation? How the patient's presentation will be? With reduced follicle structure, reduced endometrial thickness. Okay. So in such cases, what we can done? Some medicines like Vata Pitta Shamana and Arthavajanaka or Pushtigara treatment. So Kumara Kashaya, Vidaryadi, Ashwagandha, Draksha preparations, we can get result. Then Daduk Shayaja. There is a group, Daduk Shayaja. Here we can use Shadavaryadi, Ashwagandha, Lakshmana. Sir, just medicine choice I described. Then out of this Vada Kabaja, coming to a important one, it's about PCOS. Just some points about PCO. In classics, we are not, in our Yoni Roga or in our textual references, there is no PCOS. Okay, am I correct? Some patients are coming with us, doctor, is there any treatment for PCOS in your treatment? Or somebody asked about that, doctor, have you any treatment for sperm allergy in your Ayurveda? I think so most of the patients are asked this with dust allergy or like symptoms. But the patient is suddenly come to the OP and asked me that, is there any treatment for sperm allergy in your Ayurveda? Just I wondered. Then I told, yes, we can try. Just I take the case, complete history of that patient. The presentation was typical Paithika Yonisrava. Because sperm allergy means the sperm is, while coming to the, entering into the lady, that sperm is act as a foreign body. Okay. So there may be any dosha predominance or any dosha problems along with that lady or gent. So Samshodhana will be the treatment. While analyzing that case or history, that patient, a lady patient was presented with typical Paithika Yonisrava, the presentations like Pitta predominant, etc. So the Pitta Shamana treatments given to that lady, that patient got conceived. Because the at that time we say that no sperm allergy in our Ayurveda. So the chapter is closed. Like that PCO is now. We have treatment. How? We understand the dosha, dushya and involved. Okay. Here in our textbook, Nashtartava described, Grandhyartava described, Pushpatni described. Okay. So this can categorized in such way. What's Nashtartava? Once Artava is there. Now it's lost. Doshe Ravrda Margatvat Artavam Nashyati Striya. Vada Kabhavrda Margana to Apravartamanam. Here Dosha Rodham, Vada Kabha Rodha will be there and obstruction of Srotas. Presentation will be different types. If the PCO presentations will be so many types. Obese PCO, lean PCO, PCO with amenorrhea, PCO with 6 months amenorrhea, PCO with 1 year amenorrhea, then PCO with heavy bleeding. So different presentations are there. So we can't correct say how to protocol, how, while we are preparing this protocol, we can correct design a protocol for PCO. Because according to different presentation, the formulations and etc. are different. Here the typical Nashtartava features, here Kapavata Avarana and Pittakshaya. What may be the reason? We know, all of us we know, Dushta Bhojana, Dosha Dushti, we simply calling it as a lifestyle disease, okay? So, Dushta Bhojana, Dosha Dushti, Kapavrittikara Ahara Vihara, which leads to Rasadhadu Dushti, and then Arthavarakta involved. Not only this Rasadhadu, here Mamsadhadu is also involved. This formation of cyst, Gatra Gaurava are the other manifestation. Then Medodhadu is also involved. Here Stula, mostly Stula and Megha, but not compulsory Stula. Then Shukla Sanchaya, this is the typical feature. If there is lean PCO, if there is obese PCO, if there is then heavy bleeding, every PCO, typical feature is the Shukla Sanchaya. There is no ovulation to that patient. Then coming to this, some classical references, we think about Jadaharini. Have you heard about that? Jadaharini? We studied during that BMS class. Okay. Vridha pushpam tu ya nari yathakalam prabhashyadi stula laumasha ghandava pushpakni satu revati. Some typical features of, well, imagine, while patient is coming to our clinic, we have to imagine the doctor become a Jolsya while the patient coming with PCO. Some features like if there is hirsutism, oh yes, we just imagine just before saying the other features, we telling that there is no periods, there is no ovulation, maybe black discoloration like acanthosis, like then acne vulgaris, okay. Other symptoms we are telling. Oh, then patient may be surprised. How doctor can this? In such a condition is about PCO in our clinic. Then coming to the Samprapti. Samprapti we're considering is also these different varieties we have to consider. Then obese patients, dosha will be Kaba increased, Kaba more than that of Vata. Pitta, Shina stage. Dosha Vikriti, Avarana. Then Dadu, from Rasa itself involved, even though in obese, Meda and Kleda Adhika involved. Datutni, no doubt. Even though there is the obese patients are coming, there is no Nimandya will be there. Srododushti, maybe Sanka. Then moderately built patient. Here, in previous condition, Kaba is more. Here Kaba 2+. Okay. Then Vata, Dosha Vikriti Avarana, Dadu, Metas and Rasa involved, Datukni, Manda. Then lean patients. Here, Sthanika Kaba is only increased. Not the complete Kaba, but the Sthanika Kaba is increased. Sarvadehika Kaba is only lesser amount. Dosha Vikriti Avarana, Dhatu Rasa, Dhatakni, here also Manda. Then, how to design a protocol? Not completely designing, just only some points. What the things to be considered. We described what's the nidana of Nashtartava. So, coming to the treatment also, Tatra Samshodhananam Agneyanam cha Drivyanam Vidivat Upayogaha. Pittalai Rubajaret Tat Pravartamanam. So, that's our treatment principle. In some cases, if we are using Agneya Dravya, the patient is not good. If the patient presented with 6 months amenorrhea, if you are doing some Agneya Dravya, etc., some patients will respond within 1 or 2 weeks. Sure. Some patients are presenting with 6 or 7 months amenorrhea, but with our 1 week medicine or some inducing medicine, the patient will respond. But in some patients, they are present only 1 or 2 months amenorrhea, but not responding. Okay. What may be that reason? Here, the important one is the thickness of, you just look the endometrial thickness. Then apply our medicine. Here, if the endometrial thickness is more than 6.5 mm, then no doubt, like hormone tablets. If you are taking 5 days progesterone tablet, the withdrawal bleeding will happen. Like that, we can say that with our medicine, within 7 days, period will happen. What's the reason? Endometrium is ready to bleed. In such cases, we can use Vata Kapha Shamana medicine, Kaba Meda Chedagara, Shodho Shodhaga, Agni Deebaga, Pitta Vardaga. Naturally, it become Artava Vardaga. Here, so many medicines are there, like even simple. We can start from Amrutotara, Gandhava Hastadi, Abhayarishta, Chandraprabha Gulika. Even this medicine, Pulilehya or Kalyanakshara, Rajapravartini Vadi, everything can induce bleeding within 1 or 2 weeks if there is endometrium is more than or sufficient amount, not correctly 6.5 or that sufficient amount. In some patients, even though these medicines, if you are giving this medicine, if endometrium okay, not responding. Which cases? Here, from so many years, some patients are using hormonal pills for the induction of menstruation. Commonly, we can see in our clinics that if the periods is not, they are taking 5 tablets of or 5 or 10 tablets of Primalute or Progesterone tablet they are taking. After 5 days, there is a withdrawal bleeding happening. Then there is no exercise, no food changes, no pathya. They are going like that. Then after 3 months, after 4 months, oh, my periods is not gained. Then again, she's taking same tablet. Periods also came. So many patients in our clinic, the patients are repeating this thing. In such cases, if there is endometrium is 7 or 8, will not respond suddenly. Okay. So, then coming to the next group. If the patient is having below 6, in such conditions, first we have to give that patient to some Agnivardhaka medicines. Agnivardhaka and Anilomaga like Saptasaragashaya, Hingojadi Churna, etc. are given on the first step. Then we have to give small quantities of Gridha like Sukumara Gridha, Dadimadi Gridha or Kalyanaga Gridha. According to the condition of the patient, we are giving small quantity of Gridha in empty stomach that will improve which endometrial thickening. Then after improving this endometrial thickness, we have to withdraw this Gridha and give next Tikshna drugs. Okay, this is the line of approach. If there is a sufficient endometrium and if it's not sufficient endometrium. Okay. Then Shamana treatment. In most of the cases, Shamana treatment is enough, but we have to convince or educate the patient that not only the medicine, we can do miracles with this medicine. No. With the proper exercise, with the proper pathya, then only this medicine will respond. So, even though the interval of menstrual period is less than 2 months or 2 or 3 months, BMI is around 25, infertility period is less than 3 years, we can start or go with internal medicines or Shamana treatment itself. But the interval of menstrual period is more than 2 months. Not more than 2 months, in most of the cases, even 6 months, it will respond with if sufficient endometrium. But if now explained type cases, only the withdrawal bleeding and only induced bleeding, in such cases, Shodhana treatment is mandatory. No doubt. Because in such conditions, with internal medicines and exercise, even though we can go to an extent, but it can improve without Shodhana treatment. What are the Shodhana treatment we can do? Even in case of PCOS, Snehabana is not mandatory in most of the cases. Just I mentioned in small quantities of Sneha or Gridha to improve the endometrial thickness. That's enough. Even to keep the regularity of the cycle, if you are just get a periods, then stop the medicine or continue the same medicine. Not that practice. Here we have to do after attaining a period, then to continue small quantity of Gridha to 14 or 12 days, then withdraw that Gridha like that. Then only the periods will become regular. Okay. In these cases, Shodhana therapy is needed. I explained which cases we needed. Here, Snehapana, Vamana, Virechana, Vasti. Vasti is having wonderful role, like Anivasana Vasti, Niruha, or Lekhana Vasti, Kshara Vasti. It's about important one. Then Nasya. Nasya can also roll in. Because this correction of this hypothalamo, pituitary and ovarian axis, here the role of Nasya comes. Then Shodhana Chikitsa, not explaining in detail. Here, Takrapana or Udvartana on the first stage. Rukshana, first we know how to do the Shodhana procedures. First of all, Rukshana, then Snehana. While selecting the drugs for Snehana, for ladies or for considering women, which is the best one? Taila or Ghrida? Taila. Okay, sure. In Taila also, there is Tila Taila, Sarshapa Taila, Pippaliyadi Taila, we can use for Snehapana. Ghrida is also using in some conditions, not only Taila, in combinations also. In large quantity or 3/4 quantity of Pippaliyadi Anivasana Taila mixed with 1/4 of Sukumara Ghrida. It's a wonderful combination in PCOS. Then Sarshapa Taila. Sarshapa Taila is effective in conditions like obesity, then insulin resistance, acanthosis nigricans, heavy hirsutism, etc. There may be a chance for insulin resistance. We are expecting that. So in such conditions, Sarshapa Taila is a wonderful choice for Snehapana. But patients will take only the Sneha, Sammik-Snigdha Lakshana will obtain within 5 or 6 days maximum, because can't tolerate more quantity. That's the problem. Here, first Snehana, we select the medicine, Taila or Ghrida, like Varanadi, Sukumara Ghrida, etc. choices are there, but even though prime importance give to Taila. Then Sweda. Vamana is also will give the good results in amenorrhea associated with PCOS. If the patients are not responded with this Agni Vardhaka medicine, if there is endometrium not responding, then after Vamana, most of the patients will become menstruation will wet. Virechana, some according to condition we can select. Then Vasti. Vaitarana Vasti is good because Amlika, etc. are adding in that. Then Erandamuladi Vasti for Analomana. Kshara Vasti. Then Lekhana Vasti we are putting Shatapushpa Churna and also Sarshaba mixed into paste and Kalka in such conditions. And along with Erandamula Kashaya, we mixing Dhanyamla for getting the Lekhana property. Then Uttarvasti. Uttarvasti is also like using Pippaliyadi Taila or mixed with Kshara, Kalyana Kshara mixed with Narayana Taila or Pippaliyadi Taila, Kshara Taila. Are to be found good. Then if there is, this is the typical or common feature of Nashtartava with amenorrhea, etc. But if there is profuse bleeding, the line of approach will change. In such conditions, can we give this Kalyanakshara, etc.? No. Here, the only condition in PCO where Pitta Prabhava is seen with this profuse bleeding. In other conditions, mostly Vata Kabaja will be the presentation. If the profuse bleeding came, stop all the medicine at first. If Amanubandha, just Amakara medicine should be given, Amapajana medicine should be given and wait for that. Then after the Amapajana, then only we have to give Stambhana medicine. Okay. So this is a different presentation of Nashtartava. So just the second topic is over. First Kritshartava we just covered. Second is Nashtartava. Nashtartava different categories. Commonly we can group into Sandarpanota or Abadarpanota. Dadukshaya or Pushtikara treatment is the one line of approach. The another is the Avarana, like Shodhana treatment, like that. Okay. Then coming to, it's okay. Profuse bleeding, Amananda will get next this topic also. After this topic, any doubt, please check. Next, coming to Amidartava. Here, the different presentations, heavy bleeding with regular cycles, heavy bleeding with short cycles, heavy bleeding with irregular cycles, scanty bleeding, then scanty, prolonged and clotted bleeding. So first one variety, heavy bleeding with regular cycles, typical pitta. Heavy bleeding with short cycles, also pitta. Irregular cycles, may be chance for sama pitta. Scanty bleeding, here also chance for scanty bleeding but the prolonged, vada pittaja or dadakshayaja. Scanty, prolonged but clotted. That may be due to kabaja. Here, in our classic, there are so many classifications like Rektayoni, Asrja, etc. we studied. Paitika Asridhara, etc. So many classifications are there. So coming to Pradhara or Asridhara, what may be Nidana? Are you think about it? Mostly this Lavana, Amla, Kadu, Guru Vidahi, Adhyashana, Ajirna, etc. are the reasons for it. Then whatever the things changes into Rekta Pittagara, Amla Paga, Ushna Virya, whatever it may be, like Shukta, Dadi, Mastu, everything, Surya, whatever it may be, changed into Amla Paga, Rekta Pittagara, Ushna Virya. That may be, that will increase or that will lead to Amidartava or heavy bleeding. So what is the important patya there? Just talking about Nidana itself, we have to think about Chigirsa, because Nidana Parivarjana is about important thing. While we are giving the Ashoka Kshirabhaga or Masaligadradi for Stambhana, Shatavariyadi, whatever it may be, if the patient is taking Lavana, Amla and Kadu, there is no result will be there. Then Vihara. In our textual, there are so many Viharas are explained. If the patient with heavy bleeding, she doing her day-to-day activities and her heavy works, not day-to-day activities, her heavy works, that may leads to, again, heavy bleeding. So like Garbhapada, like abortion, and so many Abhighada, Adimaiduna, Advashana, everything will lead to Amidartava or heavy bleeding. Then here, what's the dosha predominant? All doshas are involved here also. Mainly Vata, Abana and Vyanavada. Pitta, Pajaka, Renjaga. Kaba, Kledaga Kaba. Dushya involved, Rasa and Rekta. Agni, here also some cases, Agni Mandhya or Agni Vardaka, in some different presentations will be there. Srodhas, Srodho Dushti, we know. Then different types of Asrikdara. Here, one important is the, most commonly we are practicing, is the Paitika Asrikdara. Because some patients will explain that if one tap is opened, the flow is like that. It's continuous flow. This is the Paitika Asrikdara. Here, Ushna, Brishavegi, Nidanta Rektasravadi, it's continuous bleeding. Askandi, there will not be any clots. Daha, Trishna, burning sensation, and it will be increased with Amla, Ushna, Lavana, Shara, Sevana. This is the typical Asrikdara. Okay. Then scanty and prolonged bleeding with Vadika or Kapaja Asrikdara will be there. Avaranajanya, like PCO. If in PCO cases also, after continuous amenorrhea or 6 months amenorrhea, when bleeding is coming like clouds and heavy bleeding, that is Kabaja Asrikdara. Clotted like Grandhi Artava, then clotted bleeding will be there. Next, Vadika. Vadika Asrikdara. This Asrikdara is having pain, with pain. Shava Aruna Varna, Rukshada will be there. Askandi, Vedana Yuktam, and Ruksha Ahara Shila, it will be increases. Here, previously explained like Kabaja, Panduvarna, Ghana, Pichila, Guru, Snigdha Srava. Skandi, there will be clotted bleeding. Mandaruk, Chardi, doctor asked, this kabaja symptoms, maybe most of them are with ama symptoms associated, like aruji, hrilasa, it may be increased with the guru bhojana, like conditions. Then the treatment principles, first, nidana parivarjana. One patient is coming to OP and written the prescriptions to that patient. After saying that, I just analyzing the USG, no problem, nothing. It's a typical DUB without any abnormalities, but dysfunctional uterine bleeding, like typical Asrigdara presentation. After writing the prescription medicines, and I advised her not to take this Amla, Lavana, Kadu, etc. At the same time, her husband told me that, doctor, her favorite food is the pickle. Even morning breakfast itself, she took the food with chapati or dosha, mixed with the pickles. And even lunch, night food, every time she used the same food. This I told that. First you stop the eating pickle. Then only you have to take our medicine. Otherwise, no result. Nidana was the main reason for her Asigdara slice in the Nidana. So, Nidana Parivarjanam and assurance is important. Rekta Pittagara, Rekta Adhisara, Rekta Arshas treatment. While mentioning the Adhisara treatment, here also one important thing we studied during Nidana. If there is Gradida, use the Haridegi itself. Am I correct? If there is Gradida flow of Mala, then increase that Mala. Like that here also. Here if there is clotted bleeding, you don't stop. Okay. Then Yoni Vyapat Chigrisa, Rekta Stambhana Ubayas here. But considering to Chigrisa treatment principles, Anulomana is there. Garbhashay Shodhana needed sometimes. Kledahara and Stambhana. But if there is Pradara, our first choice, which is our first choice? Stambhana. It's okay. In some cases, it's okay. As told earlier, if there is no Amanubandha, the bleeding is continuously like from the tap, flowing like from the tap, sure, they're needed Stambhana medicines. Otherwise, she will get fever on the next morning. If we stop or if we give the Stambhana medicines associated with Ama Lakshanas, the patient bleeding may be stopped. The next day, one experience I felt that, I thought there no chance for Ama, Stambhana medicines are given. But after 2 days, the patient came and she told that, doctor, all bleeding is okay, bleeding stopped. But I feel chills and fevers. So we have to give the treatment for Amabhajana the next time. That's an example. Okay, so Anulomana, Garbhashay Shodhana, Kledahara, Stambhana. Amavaste nadu stambhayet. We have to consider the patient health, surely, because continuous bleeding, she may be fed up. The HB, while checking this HB, it may be 5 or 6 in some cases, because due to continuous bleeding. In some such cases, no doubt, Stambhana needed, but we have to think in mind that Amavaste nadu stambhayet. Then, if Anulomana needed, in some conditions, Anulomana needed. In such conditions also we are given Pushyanaka Churna with honey, total Stambhana will happen there. Even Mala also become Stambhana. Okay, so some cases Gandharvastadi, Chirvilluadi or Vashwanara Churna needed. Then Garbhashay Shodhana. If there is scanty bleeding, spot bleeding, such conditions, no Stambhana. Here Garbhashay Shodhana like Pulilehya, Pulikuramba, Saubhagishundi, Drauna Pushpi, Saptasara, Palashatak, etc. Then Kledahara. This is the, considering the Stambhana choice, I think Kledahara is the better choice in most of the conditions. Here, the Padavla Kadurohinyadi, Traindyadi, Vasha Guluchiyadi, Guluchiyadi, Tiktaga. These medicines have a property to Sangrahana, not only Stambhana, but having some Sangrahana property. So, it not completely got into the full stop or Stambhana, but just reducing that bleeding gradually. The patient become comfortable and the pain reducing, then bleeding will get reduced. Okay. So, Tiktaga, Mahatiktaga, and then Vashaguluchiyadi, etc. are the good choice in practice. Then Stambhana medicines also there, like Musaligadradi, Shataviryadi, Pushyanaka Churna, Shogachira, etc. Surely we can identify that there is no Amanubandha we can give. Then Ksheerapaga. Ksheerapaga is a wonderful result. Here also, Agni should be there. Otherwise, if you are giving to Ashoka Ksheerapaga, next day the patient will get fed up. So decreased Kaba, Agni Deepti, Vadadika, Vadapitta, then we can give Ksheerapaga. Ksheerapaga, like Ashoka Valkala Ksheera, is a better choice considering that. Then some treatments like Anuvasanavasti with Tiktagagrada, Takradara, Nalpamara Kashaya, Ksheeravasti, etc. are giving in some patients, giving some result. So, Amidartava topic is also over. Okay. Here, Amidartava, I have to just remember that four treatment choices are there: Anilomana, Kledahara. Along with that, if you are using Stambhana, just consider Amavastha also. Okay. Then so many things are to be added to that Amidartava. Just if one patient is presented with heavy bleeding, then I took her medicines for Stambhana medicines, and like bleeding is not stopped. After that, I just asked her that what may be the reason for this continuous heavy bleeding. After 1, 2, or 3rd visit, she told that there was intrauterine contraceptive device. In most of the copper-T or contraceptive devices, it will not cause, not 100% sure, all the person with copper-T cause Amidartava, but the patients presented with heavy bleeding or Amidartava, you just inquire, is there any contraceptive device? After removing that device, then only the bleeding will get controlled in such cases. If you are giving Ashoka Ksheerapaga, if we are giving Musaligadradi Kashaya, Pushyanaka Churna, everything, that will not respond without removing the root cause, what may be. In some cases, we are checking about HB, thyroid dysfunction. So many tests we are doing. But one thing, two important things we have to remember that. One is the pregnancy test. Just firstly, I remembered. Pregnancy test is an important one. The next, liver function test. Here, most of the cases are associated with liver dysfunction plus this DUB. So the liver correction or acne correction is an important considering this. In such cases, Vasha Gluchadi like Kledahara medicine will respond very well. Okay, so we have different choices of medicine, but our rule how to identify the key to open or to enter into that Asragdara. Then coming to Yonisrava. So the next topic. It's very commonly in our clinical practice, we're getting different varieties of Yonisrava. Broadly, we can classify into Kaba Adhika Srava and Pitta Adhika Srava. Okay. So when the patient coming with Leukorrhea or Yonisrava, suddenly we are starting our medicine with Shadavari Gula, okay, will maybe respond well. Shadavari Gula mixed with Shankhabhasma will respond very well, okay. But it's our duty to analyze in which dosha predominant here. Here, what may be the patient presentation if Kabaja? What may be? Simple, common. Nature of discharge, thick. Then some classical references we study about Kabaja. Which are they? Slaishmigi, then Upapluda, Vipluda, etc. are coming under this variety. Then the main cardinal features to identify or differentiate this most of the Yonisrava or Yoniroga we have, there may be Vada involvement is there, but Kabadika or Pittadika we have to consider. Here, thick discharge, okay, Shweda, Pichila, Shaitya, Alpavedana, Kandu. Kandu is the important one. We have to be, if exclude the worms or that action, all other Kandu, appearance of Kandu will be due to Kabaja Yonisrava. Okay. Then in modern, considering there are different, while we are getting to then investigations, etc., there may be candidiasis or TB, trichomonas vaginalis, etc., will present. Then we can categorize these things into Kabaja, Yonisrava, according to the presentation of the nature of discharge, other symptoms, etc. Then in most of the clinics we get this type of discharge. Okay. So I think while considering the Darshana Sparshana Prashnam, not only the external appearance only, but considering the gynecological examination, you go through at least this Casco's instrument. We can, because through then only we can get a correct picture of that disease. Some patients may be exaggerating. Some patients may be there is no symptomless. But while examining the cervix, there may be cervicitis, chronic erosions, etc. So after the proper examination only, we have to go correct diagnosis of that disease. Okay. Then profuse, thick curdy, white, severe pruritus, and dysuria. Then TB, how maybe profuse discharge, thin and frothy nature, cream or light green discharge, pruritus, dysuria. Here on appearance of the cervix will be like strawberry. Okay. The previous one, candidiasis, is a typical feature. The next one is the TB vaginalis. Here, strawberry appearance for the cervix. So these are the Kabaja varieties. Ubapluda, Vipluda, like we explained, Kandu, then Shaitya, Alpavedana, etc. is having Kabaja discharge. Then Paitiga or Pitta predominant. Which are the diseases we studied? Paitigi, okay, Paripluda. Then what are the symptoms like that? PID, pelvic inflammatory disease. The conditions or the patient presentation will be, most of the presentation will be the patients touching on her lower abdomen and telling that the correct, while we are examining to the fornices, it will be, the patient's hand will be on, correctly on her upper portion of her fornis. Here, on USG examination itself, we can see that POD, pouch of Douglas, fluid filled with this fluid. Okay. Here, what are the symptoms? What are the main presentation? Patient tell, Daha Bhaga, okay. In patient term, burning on lower abdomen. Okay. Burning lower abdomen with yellowish discharge. There is no itching. And other important feature is the dyspareunia. If you talk about that patient, if the patient is presenting with pain on the lower abdomen, touching on her fornis, and tell, you can reach a proper diagnosis while asking symptoms of dyspareunia. Daha, Paga, Pudiganda, Ushna, Kunaba, Neela, Pida. Some patients may present with like blood mixed with the blood discharge. Maybe some erosions on examination, then only we can get a cervicitis, picture of cervicitis there. Pida, yellowish discoloration. Sroni, Vangshana, Ruk, Toda, and Jora. Jora is also a typical feature. So not complete time Jora. It may be the evening rise of temperature, or sometimes she feels a Jora and Amato also there in such conditions. Okay. So this is the Pitta predominant. If Pitta predominant features like Daha, Paga, Usha, Pudiganda, Jora, Ushna, Kunaba, Neela, Pida, Asida. Okay. It's the typical Paitigi. Then here after PID, getting PID, the tube and other organs will become like inflamed. If features of Vada along with Pitta, if Pitta is the typical Pitta, Paitigi Lakshana will be there. If Vada along with Pitta, Shuna means signs of inflammation is there. Sparsha Saha. This Sparsha Saha means we can feel while examining on lower abdomen, per abdomen palpation or per vaginal palpation we will get. Neela, Pida, Asravahini, Vasti Kukshi Gurutva, Atisara, Arojaka, Shroni Vangshana, Toda, and Jara. It's the typical feature of Paripluda. Okay. In Paripluda, I think Susrutajarya described that Gramya Dharma Rujabrisham. So, from the patient's words itself, then also we can identify the features of Paripluda. Then Sanibadigi. Here we are confusing with so many diseases. Okay, pruritus is there. Oh, we think it's only Kabaja. No, may not be there. So offensive discharge. Oh, it may be Paitigi only. Pitta treatment is enough. No, sometimes it's offensive, blood-stained, irregular, frequent, and postcoital bleeding is there. You just think not only it's Paitigi, not only Paripuda, it may be chance for genital malignancy is there. So, without delay, we just send for a pap test. If not enough pap test, you send for a biopsy. Then after that, we can identify the case and we can treat from outside itself. If we will get an inflammatory sign, what will our treatment approach? We can give for the treatment for the Tribala Gugulu, like douche or etc. we can done. And if we get CIN or cervical intraepithelial neoplasia, different grades are there. If get first grade, in modern also there is no, only after 6 months there is follow-up is there, but no treatment, specific treatment is not giving. But at that time we can interfere with our internal medicines like Tribala Gugulu, Rasagandhi Mirga, then Gugulu Tiktaga, Nirgundia, so many different choices of medicines are there. Then internally with douche or medicines like Gugulu Tiktaga or Mahatiktaga, Grida, Piju, Yoni Piju or Yoni Purana, we can done. So we will get the result after 6 months. There may be no cell tissue, so cell changes will become disappeared. If there is on the first stage, or if we will get inflammatory smear, we can done treatment. After 6 month follow-up, the inflammation will reduces. So before going to treatment, assess the dosha predominance, Aknibala, general health of the patient and avastha. Here also we know amavastha. The symbol amavastha we studied in our class 6, that will be applied here also. Avibakkum, asamyuktam, durgandam, bahupichilam, sadanam sarvagatranam amavityabhidiyate. Here also if the patient presented with leukorrhea, then only we have to, before selecting the medicine, if there is amanubandha, then go for first line of treatment should given to ama. Then coming to next Kaba Shamana or Pitta Shamana medicine properly. Itching, foul smell, profuse, sticky white, general weakness, decreased appetite, association of ama, or we can identify Prabodha dosha. So, Tatra Alpe Langanam, if there is Alpadosha Langanam, Madhyame Lankana Bhajanam, Prabodhe Shodhanam. Same we can apply here. So, general and local Shodhana if needed. Virejana, in some cases we needed to, even though the treatment approach considering for Yonisrava also, if Virejana needed, you have to do. We are just only for Shamana medicine, in OP we can do. Then Chalna if possible. Shodhana, like if Vada predominant, then Erenda Sukumara like that. Paitika Avibhati, Kabajatra Vuchurna, some choices. And consider, especially adolescent girls, if presented with leukorrhea, the first important treatment we have to give, what? Deworming is compulsory. With the deworming itself, most of the discharge will go out. So, and also Patya should consider. Then after 1 or 2 weeks, for if Amalakshana is there, given Amapajana drugs on the like Amadotara, etc., Amapajana, Shaddarana, simply we can give. 1 or 3 days, means up to Amapajana, got the Amapajana. After that, if the discharge become clear, sticky nature decreases, itching decreases, no foul smell, appetite increases, then we can go for Shamana treatment. In such condition, what we can do, or what are the medicine choice? Here, if Kaba, Aregodhadi, Nirgundhyadi, these are the, I think, in practice, better result with the Aregudadi and Nirgundadi, etc. Then so many choices are Aregodarishta, Lodra, Sava, Bhayarishta, Tribala, Gugulu, like. Most the important thing is to identify the dosha predominance there. Then if Paitiga, Guluchadi, Tiktaga, Musaligadaradi, Nalpamaradi, Shataviryadi, Drakshadi, So many choices. Here Chandraprabha, even though Tridosha Hara, it's better found in Pitta predominant conditions also. Then in OP practice, you can use the Dorset, simple vaginal douche. But here while selecting the drugs also, give the importance of dosha predominance. If there is kabaja or sticky discharge is there, then first line we can use Tribala Kashaya mixed with the Tankanakshara is a better choice. After 3 days, the sticky nature reduces. We can observe that after doing vaginal douche with or vaginal washing with Tribala Kashaya mixed with Tankanakshara, within 3 or 4 days, according to the condition of the patient, that patient become clear. That sticky nature will become clear. In some cases, it will take 3 days. Some cases, it may 5 or 7 days, according to Amavastha and like. After the sticky discharge decreases, then again we not continue with the same medicine. Just we have to change that medicine. After this Rukshana, we have to apply Piju with Jatyadigrida or Mahatiktagrida, etc. So the first line treatment, Rukshana there. After this Amavastha clear, after this sticky discharge become clear, itching reduces, then change the medicine into Nalpamaradikwada or Piju. Instead of Tribala Kalka, we go for Yoni Purana with Jatyadigrida or Mahatiktagrida according to the condition. Okay, it will get a better result along with this internal medicines also. So then the next stage, the first stage is Amavastha, then next stage is the Pakavastha. At that time we given the Shamana medicines there. Then the discharge is almost clear. Even though most of the patients will, after 1 month or after 2 months, again the patient will come. The previous time all discharge become clear, again that discharge is there. So in such, to avoid the recurrence of this condition, if the patients become normal, appetite normal, no general weakness, then go for Brahmana treatment. If we following this correct pathway, the recurrence will be comparatively reduces comparing to other. So there are so many choices for Brahmana: Shadavari Gruda, Shadavari Gula, Ashoka Gruda, Datriyadi, like Panjajiraga Guda, Vidari Gruda, etc. And if we are putting Piju also, just simply consider Dhanandra Taila. Okay, if the discharge is okay, then also just for maintaining the pH or normalcy of the vaginal area, just go for Piju with this Dhanandra Taila. Then Patya is very, very, very important. Do's and do not should educate the each and every patient in front of us. Personal and sexual hygiene, nutritional diet, adequate water, etc. We know what are the Patya and Apatya. Just only one topic we have to pass. That is the uterine prolapse. It's very common one. In previous time, prolapse is very common among menopause age. Okay, but now it's not a criteria for this uterine prolapse. I think after 30 itself, so many patients are presented with the uterine prolapse. What are the clinical presentation of the patients? Something coming down, a feeling of something coming down. Okay, then back pain. Previously I explained one case, so presented with the Kadigraha. Most of the patients will not reveal some gynecological issues. If the patient is Kadigraha, we have to evaluate it is orthopedic or gynecological at first. Otherwise, we will lead to, the diagnosis will be misleading. So, increased frequency of micturition, a bearing down sensation, stress incontinence. This is the major, one of the important difficulty the patient felt is the stress incontinence. The patient will tell that while taking, sneezing, coughing, or just in kitchen itself, doing some simple works, the urine will be coming out. That's a major problem we can found with the stress incontinence. Then coital problems is there, difficulty in complete evacuation of urine. So consider the uterine prolapse In our textual references are the two types or two diseases are there. One is the Mahayoni and the other one Prasramsini. Two types are there. Here the uterine prolapse while examination only we can reveal it. Am I correct? First degree, second degree or third degree, and according to nature of the coming down, organ coming down, it will be cystocele, urethrocoele and rectocele. Some pictures, here we can clearly see that on front, here the cystocele, then middle is the uterus. If uterus is coming, uterocele, behind rectum, so rectocele. If on the lithotomy position, if cystocele, that will be coming from anterior portion. Then one important identification is the detrusor muscle will be there. If the patient presented with cystocele, we can identify with that muscle striations. Okay. Then rectocele. If the rectum is coming out, it will be from the posterior part. Cystocele anterior part, rectocele from the posterior part. Then what is this? Cervix. Yeah, the uterus is typically coming projectile to the outside. That middle part is the external os of the cervix. Okay, this is the urethrocoele, means uterocele. Then here, like procedentia, we are saying that complete uterine wall become outside. So the clinical features explained: urinary symptoms, increased urgency, increased frequency, and incomplete evacuation. Then if there is rectocele, bowel symptoms may be there, constipation. Most of the patients are presented with constipation, but if we are giving a vipatti churna, hridya virejana, everything, but just examine, is there any rectum is coming out? Okay. Then low back pain, discharge, mild discharge is coming throughout in such conditions. Then decubitus ulcers may be there. And most of the old age patients are presented with some bleeding from the area. While examining only, we can reveal that chance for decubitus ulcer may be there. So the management on first stage, we have to consider in mind that first and second degree uterine prolapse only we can manage. If patient presented with procedentia, you don't go for management. Now, we can give the internal medicines, etc., but less chance to respond. Shastra sadhya is to be explained. But if the patient presented with first degree, second degree, with urinary incontinence, with low backache, confidently go with our management. With internal management and also OP level, some procedures we can do. Like first educate the pelvic floor exercise to the patient. Then Avagaha Sweda. Avagaha Sweda is very good one with the Shimula Kashaya. It's very effective. Then Pichu or Yoni Purana, Pichu Dharana with the Unduru Daila is found effective. Then Shadaguppa, Shadapushpa Kalka Dharana. It can be powdered into fine powder and mixed with the Tiladaila. Then put into a gauze. Just fill the vagina. Before filling the vagina, you have to go for Kshira Sweda, just 5 minutes, or according to the tolerability of the patient, go for Kshira Sweda, Nadi Sweda with the Dashmula Kashaya and the Kshira. This Kshira Sweda, apply like Nadi Sweda, you have to apply on the, after applying the Dhanantara Taila or any Abhinga on the Yoni portion, then apply this Kshira Dhuma for 5 to 10 minutes. After that, you have to fill the Kalka Dharana with Shadaguppa mixed with this or put into gauze. After, I think one, I would like to present a experience with a patient. She's having chronic urinary incontinence while sneezing, coughing, coming to kitchen, taking any utensils. Every time the urine will be passing out. After this procedure, 9 days continuous procedures I given to that patient. After this procedures continued for 14 days, but after 9 days itself, the patient responded that the urinary incontinence will become coming to reduce. So 14 days that continued. Then after the follow-up from the home itself, I advised her to put Dhanandara Taila soaked and with put in that Yoni Purana. After the follow-up also, now also she got that only during heavy exercise or heavy coughing or only urine will come out. Otherwise it become reduced very, she become very comfortable now. So in Procedentia there is no chance, but first degree, second degree with urinary incontinence, especially in reproductive age group, about from 30 to around perimenopausal age, it will respond very easily. Then after menopause, it will be, it's a better choice is the Dhanandara Taila, not the Shadagupagalka. Here, because the yoni become dry, hypoestrogenic stage will be the Vada and Rukshada will be the, so we have to use Dhanandara Taila instead of this Shadagupagalka Dharana. Internally, we can use the Dhanandara Kashaya and Lomana like Sukumara Gruda. And Avapitaga Snehabana is also a better choice in such a urinary incontinence. We can give Avapitaga Snehabana with Dhanandara Taila or Pastyamendaga Gruda or Sukumara Gruda, etc. will give result with this urinary incontinence. Okay. So, complications of Yoniroga will also lead to so many, if we are properly managing, this may lead to different conditions. We can also say that even infertility or anapathyada is one of the complications of this properly treated Yoniroga. So, Yoni Pradoshat, Manaso Abhidhabat, Shukla Asrik, Ahara Vihara Doshat, Akala Yogat, Balasamkshayacha, Garbam Chirat Vindidi, Saprajapi. Even though the patient is fertile, the delayed conception may be due to these things. Not the asadhya or not bijadushti, but delayed conception may be the reasons due to earlier explained doshas. So we can conclude that this Ayurvedic management we can found effective in everything, especially in also gynecological disorders. According to patient and condition to condition, it differs. I already explained that we cannot stick on a specific protocol for any disease. If PCO, different medicines and different choice of medicines according to condition. Here, Prakriti, Dosha, Agni, etc. plays very crucial role in diagnosing and selection of the medicine also. So judicious blend of Ayurveda medicine and Panchakarma therapy could do miracles in the field of Striroga. Okay. Here, my humble request to all of us, all of you, that to practice, if we are practicing gynecology, the first introduction, I just remembering that, Darshana, Sparshana and Prashna. Without these, we can't enter or we can't open the lock or open the disease or enter into the patient's heart. So, thank you all. And my special thanks to, thank you everyone.
Is there any doubts? We'll have a 5 minutes interactive session.
Madam, what is your personal experience about Uttar Basti?
In my practice, I'm doing every day 3 or 4 cases with intrauterine Uttravasti. Especially here in cases like PCOS, infertility, especially this is a protocol designed for infertility. In tubal factors, PCO cases for with medicines with Leghna properties like Kalyanakshara, adding Kalyanakshara with Mahanarayana Daila or Pipilya Dhanivasana Daila, etc. It's, I think, it's a very wonderful result we'll get with this Uttravasti.
Namaste, madam. I have two questions. One is, what is the line of treatment with the fallopian tube blockage?
Okay.
The second one is, I was presented with a case of heavy bleeding, menorrhagia, with who had an intrauterine device. So once that was removed, even after that, she was presenting with heavy bleeding.
Okay.
So after serious examination and protocol,
Okay.
now she used to bleed for 15 days, and now she has come to 5 days. And the flow is like completely tap flow.
Yeah.
No clots, nothing. It's completely pure blood, and even the blood patient says is, I can wash the cloth, there is no stain.
Yeah. Okay.
It's completely clear blood. So now it has come to 5 days. I think it stops. It's a complete, that's what patient says. When I examined, when she got the scan for the first time, the uterine thickness was 14. So now even now, uterine thickness is 14 mm. Can we do anything, or it's a natural process?
Yeah. Okay. Your first doubt is the management in fallopian tube block. I have got some experiences with intrauterine Uttarabasti after the Snehana and Shodhana treatment or Vasti procedures using Shara Daila. There was a case presented with bilateral fallopian tube block was there. Done 3 cycles with the first cycle with Shara Daila, then next with the Sahajaradi Daila to be given through the intrauterine procedure. That patient, after the treatment, patient conceived. Then the other question about endometrial hyperplasia. I think it's an important, we have to consider it's very predominantly. Because endometrial hyperplasia, there may be thickness of the endometrium will become increasing and increasing. Here this doctor asked about 14 mm thickness. So there may be a chance for endometrial hyperplasia and adenocarcinoma, less chance for adenocarcinoma. So you have to rule out in such conditions like CA125 or any tumor marker, we have to rule out, and then given medicine for the first half. Leghana property medicine you have to given, like some experiences with endometrial hyperplasia. Some gynecologists advised to do the hysterectomy, but after doing our medicines like Traindhyadi, Kanchanara Gugulu, etc., Leghana medicines and Avagaha Sweda, Piju with Danandara Daila, the patient got the endometrial thickness considerably reduced to from 14 to 8 mm, and the bleeding was become normal. So it's our, we can manage in such conditions. Okay.
A case with a 32-year female who was presenting with known case of PCOD. And her presentation was she used to bleed. She had delivered one baby at the age of 25, and after that she is obese with all sorts of hirsutism. She used to bleed once in 5 months. Okay. Earlier what was the thing is she used to have regesterone, only then she used to have bleeding. She was having a stressed family life and all. So after giving some of our medicines, what has the change? She was not financially sound that she could afford our medicines throughout. The change what I observed, she regularly bleeds at the time of 5 months. Once she starts bleeding, she'll be having bleeding for at least for a period of 45 to 60 days. And at any cost, I mean, she had consulted a gynecologist wherein somebody suggested Primilute to be had, 3 TID. 3 TID also she was not stopping it. And finally what that Mukkuchi, Arache, Vidangan Varya, all those things cost effective ആയിട്ട് ചെയ്യുന്ന കാര്യങ്ങളായിരുന്നു. പക്ഷേ the patient still the same things happen. I mean, every 5 months she bleeds, and the bleeding continues for 45 to 60 days. 15 with Pushyanogam, Stiplon, point capsule, Parpada, Bola Parpati, all those things used to reduce but never, what you call it as, put a stop to the issue. Then what happened, I used to give Draksha the Panakam throughout. So her HB level always used to be like 9, that range it used to be there. And her bleeding is so profuse that after 15 days she has to change at least 6 to 8 pads per day. Okay. So this was the, I mean, up that patient. How to manage that? Because in that particular case, when we try to understand the samprapti. So as we know, rasam, rakta, mamsa, medas, basic. So rasam, raktam, the upadadu becoming from rakta, it's becoming artava. Stanya only in pregnant ladies.
Okay.
So I always used to wonder, now a female when she bleeds once in 5 months, what is happening to this rakta?
Yeah, okay.
It's rakta becoming mamsa. This rakta, where is the artava at that particular time? And then when that artava started after 5 months, for next 2 days, from where is this artava coming? When we think in our dhatu parinama level.
Okay.
So could you please comment on that with respect to our case?
Okay. I experienced in such cases. Here I found result with Vadapitta Shamana management is here. Because if you are giving Lekhana properties of medicine, that will also cause the heavy bleeding. Bleeding will be heavy while coming also. So like Traindya, Kabha Pittahara and Pagahara Lekhana property medicines. I think the choice like Traindyadi and Kanjanare Ugulu along with Punarnava Mandura will give, I think in some experiences, some cases I experienced in such conditions, and also on continuous time or every day we have to use the Draksha or Guluchyadi as a Panaka, and the medicines like Traindyadi, Kanchanare Ugulu and Punarnava Mandura etc. will, I think, along with their food and lifestyle changes, something can modify. Yeah, throughout the cycle. No. Just after the bleeding phase, we can stop this medicine, and the Draksha or Guluchia, this maybe, I think, better choice at that time. Okay.
I have a case of a lady of 25 years, unmarried. She's a teacher, a little obese, and with heavy bleeding every 15 days. The bleeding continues till about 8 to 10 days. And she was diagnosed uterine fibroid in the fundus, and they have advised her to married, get conceived and get killed, and after that we will manage about the uterine fibroid. That's what they suggested. So here I have given her Pittahara type of treatment in the onset, but she is obese. There I think it may become Brahmana, and then once again she may put on weight. All these doubts I have. Just recently, 20 days ago, I got this patient, and I have given the medicine. How to go ahead? One question. And in uterine prolapse, does Kutaja help in this thing? Because I had a case, and I treated it with just Kutaja Kashayam. And
Which Kashaya?
Kutaja. Does
Okay.
it have any role in that?
Okay.
And what is the role of Lajjalu in Stri Roga?
Yeah, okay.
Because it is freely available, because I am from a rural background, and it is very freely available. So Lajjalu, can it be used as a
Yeah,
common
okay.
drug in
Okay.
Stri Roga?
Here, Kudaja action not experienced in uterine prolapse. We can add as per the doctor. The Kudaja can be, I think, I don't know how to, the role of action, don't know, but even though we can add some experiences from that doctor also. Then Lajjalu is also given in these prolapse cases. Kalkadharana we are giving. Lajjalu Kalka is also giving in, and also uterine bleeding, some dysfunctional uterine bleeding, this Lajjalu is found effective. Okay. The next fibroid case, I think that question is not much clear, but the heavy bleeding with uterine fibroid, that I think. Okay. In such cases, we have to do, yes, okay. Here also, Kabha Pittahara treatment, I think is better. Previously explained like Traindyadi, like Kabha Pittahara, Leghana, Pagahara, I think better. Otherwise, if you are using this Varanadi and Tikshna drugs, the bleeding will become more and more increases. So, for Rukshana, means for Snehana, this Sahasradi Sevya or Dhanandara Avarti, or by drops we can give internally, and other Kabhapitta line of treatment is better. Thanks. Medicine for infertility. I think infertility is a large topic. So considering, according to different cause we are using. So after, in case of infertility due to PCO, we are giving medicines for ovulation at first. Then after getting the ovulation, medicines like Lakshmana, then Phalasarpis, etc. for implantation. So according to the condition only we can go for this infertility management. Which medicine? Lakshmana. Lakshmana, the oil. Loham.
Lakshmana
Okay,
Loho.
okay. Loha.
It is
Okay,
available
okay.
in our market.
Yeah, not much experience in that. We are using Lakshmana as Kshirepaga. Just after getting ovulation, Lakshmana given us the Kshirepaga to the internally, and also with some implantation medicines to help the medicines which help for the implantation like Phalasarpis, Kshirabala, Lakshmana, Kshirepaga, etc.
Now, if patient can't digest Phalagrita, what else shall we give?
Which case?
If the patient doesn't digest Phalagrita,
Phalasarpis?
if the patient doesn't digest Phalagrita,
Okay, it's not mandatory to take Gridha itself. We can use the small drop of medicines like Kshirabala, then Kshirapaga, or otherwise boiled water with Shatavari and Bala is needed. If Phalasarpis is Guru, if the patient is not much appetite and much acne to digest that, we can use with such other preparations. If even though the patient is not digestible to take Kshirapaga, you can just boiled water like Lakshmana or Shatavari and Bala, etc. we can use. Even Nayopaya Kshirapaga or Nayopaya Kashaya is to be better in such cases.
Madam, which is the drug of choice in case of dysmenorrhea?
Dysmenorrhea,
Yeah.
drug of choice.
Yeah.
So this also according
and
to
Vatpardhan, if Vatpardhan is there.
Vata Pradhana. Main choice I think Saptasara Kashaya, and then Dhanantara Gulika, Hingojadi Churna, etc. will give result.
Thank you, ma'am. Thank you for the invigorative session. Now I invite Dr. Priya, Senior Medical Officer, Aryavaidya Chikitsalayam and Research Institute, Ramanathapuram, to felicitate Dr. Asma B. ma'am with a certificate and Punnada as a token of our gratitude.